What we're going to do here is each of them are going to introduce themselves, and then they will each get 5 to 10 minutes to talk about their experiences and exposure to competition. And then once they do their individual overviews, then I'll go into a Q&A, and then you'll have the chance to have the opportunity to ask your questions of them also. Okay? Dave?
I'm Dave Wortman, CEO of Diagnotes. We were fortunate enough to win last year's Who's Your Healthcare Innovation Challenge, the first Who's Your Healthcare Innovation Challenge, and it was a particularly helpful accomplishment for us, in part because of the kind contribution that it made to our balance sheet, but more importantly, the chance to work with a lot of folks in the healthcare space and to learn even more than we knew at the time as to the nature of the problem that we were attempting to solve and the best way to go about doing it. So a big help. We also were fortunate enough to win the BioCrossroads New Venture Competition. That too contributed to our balance sheet. And we'll talk at some point, I suppose, about the outcomes of all those things. So.
I'm Matt Hall. I'm a project director with BioCrossroads and also a principal in our seed fund. And we have here today mostly to talk about our BioCrossroads New Venture Competition, which Dave briefly mentioned. The Diagnotes was the winner of the first annual New Venture Competition last year. We have launched that program for its second year. The application period is actually open now, and it's really to identify and promote and award promising Indiana-based life sciences companies that are addressing real market solutions with real market problems with innovative solutions. The competition offers cash prizes. I think the total cash awarded, the total cash advertised last year was $60,000. We actually awarded more than that. We awarded $70,000 because we saw a lot of promising technologies and decided to add an additional award to the program. This year we have the same $60,000 in prize money that's available, and we also have in-kind services. The program also gets some access to our sponsors. We have a great set of sponsors in the life sciences community. The entire program is presented by Creek DeVault here locally. Some of the sponsors are 5AM Ventures, which is a large life sciences venture capital firm based on the West Coast. The CHV Capital is a sponsor, as well as, I'm sure I'll forget some, but Stepstone Business Partners, the Halo Group, OrthoWorks is a sponsor as well of the program. So we're excited to have that going. It's open to life sciences companies, including health information technology companies. Dave was the winner of that category last year, so we're excited to have that open, and if we'd like to have everybody that's in the entrepreneurial space apply to it.
Okay, Tom?
Hi, I'm Tom Crone, and I work for Lilly, and I work in our clinical trials world. I've worked for Lilly for 11 years and been on a variety of transformation initiatives, typically with a technology bent. The group I lead at the moment, we call Clinical Open Innovation, and it's really about bringing open innovation techniques into the clinical development processes. So what that means from our frame of reference is traditionally open innovation and collaboration that's open and fluid is typically more of a research activity. And yet when we look at the development model, the clinical development, the trials, it's fundamentally unsustainable in its cost and productivity at the moment. And so one of the things we are very passionate about is transforming that model. And really, as we think about it, we think about transforming it from a patient-centered point of view. Something that typically life science pharma doesn't do particularly well. So Kristen happened to share one of the challenges we have, and that's with Challenge Post, which is the platform and group behind the challenge.gov. And that is around how do we represent clinical studies so that patients can understand what the research is, and if it's right for them in their healthcare situation to consider enrolling or engaging in the clinical research. And so that is a challenge that's ongoing. There's a $75,000 total prize package. First place is $35,000 and such. And the other thing that we're doing on challenges, and so challenges is one portion of our portfolio, but a real one, a part of it, is tomorrow with Brian's help and my good colleague back there, Jerry Matzek, we are hosting in our location up in Intech Park a codathon, a hackathon, against public data, open APIs, and including ours, because one of the things we believe in is enabling, engaging others in using information. And so for Lilly, that represents an opportunity to learn and to see different perspectives, something that I think is fundamental in innovation, to get diversity of perspectives. And the Codathon represents a great weekend for us to do that and to host that in our site up in Intech Park. So hopefully some of the folks in the room will make it to that. So thanks.
I'm Brian Norris. I go by the alias Geek Nurse. So for all of you, I'm a nurse at heart. I started in healthcare about 15 years ago and have seen kind of the inner warts of healthcare from the inside out. Got into informatics about 9 years ago and have since served in various different roles. Currently, I'm CEO of Social Health Insights, which titles are kind of irrelevant when you can count your employees on one hand. But ultimately, we're the byproduct of where innovation challenges can spawn health IT startups. And so myself and my colleague Mark Silverberg and another colleague of ours entered an innovation challenge last year put on by the U.S. Health and Human Services, and specifically their Disaster and Preparedness Division, to mine social media for biosurveillance purposes. And if you wonder what the heck that is, it's basically mining huge amounts of data from Twitter and presenting that logic back in ways that epidemiologists, who pretty much like only gold standard data, can make sense of it alongside of their traditional surveillance processes. We subsequently won that challenge and then thought through potentially starting a startup, but then entered another challenge to validate it. And so we also have placed in the ONC's Blue Button showcase in redesigning the Blue Button output for patients and how patients interact with data. So our views are really that we can start to bring together clinicians, savvy informaticians, entrepreneurs, designers, and developers under one house to really make a mark on healthcare.
So on the
one challenges. So my question, we got a good balance here. See, if you wouldn't have come, we would have been off balance. So my first question is, we're all engaged in challenges. We're all here, and it's a challenge, and we've got the Codathon tomorrow. Do we see challenges being a vehicle for spawning innovation and actually creating commercial solutions that can get into the marketplace? Who's up first?
Brian did it. I guess I'll go first. So the simple answer is yes. I think if you look at challenges, we all like to put money on them and say, you can go win. We won $21,000 as part of our challenge. Trust me, you burn through that very quickly. So I think the one recommendation I would make kind of post this is look at the product and say, what problem am I trying to solve? Be passionate about it, but also think of it in terms of how might this position as a product down the line. And think of your team. Mark and I have spent, I don't know how many hours together working through solutions and products along with our other business partner. And you gotta really like your team, and you gotta find the people that complement your skills versus a whole team full of the same people of skills, because I think that's really what brings value.
In our case, we had a concept for a product, and in fact had a prototype and a pilot underway on it when we came into the Healthcare Innovation Challenge last year. But for us, what it did was facilitate a pivot in our business. When we began, we were connecting patients and doctors together along with patient data from their EHR systems in order to facilitate doctor-patient encounters. What the Innovation Challenge showed us was that there was as big, if not a bigger problem of clinicians connecting effectively with each other in an informed way, being able to share clinical information about the patients that they were serving and coordinate care far more efficiently than they had done in the past. And that was the product of the innovation challenge for us. And today, that portion of our solution is the largest and I believe at this point the most important element in what we're doing in healthcare. So a big impact on us and some additional propulsion on the business as a result of it.
I would agree with both the comments here, and also just maybe add that I think these challenges and competitions are extremely helpful in crystallizing what the problems are that these innovators are developing solutions towards. So it's a great way to see what the market is really looking for in the form of solutions, and what the market what the real problems are and what the market will pay for. Where we step in is a little bit further down the line than this challenge, which this is a terrific venue and terrific event to help to spur innovative solutions and new companies that can participate then down the road in our business plan competition. So I think the answer is yes, that it's all parts of creating this environment that's supportive of innovation and entrepreneurship that all helps to spur innovation.
So all of that is great. I guess I would, from a sponsor perspective, how I think about challenges, I think of them less as events. The events are great and the prize money is nice. It's actually much more about connecting into an ecosystem of talent. And what often emerges out of the challenges is the relationships and the opportunities beyond the challenge, beyond the event. And so the event in and of itself is great, the challenge is great. The exciting thing is when we partnered support from incubators through to execution and realization, that's where it gets exciting. And so challenges are a means to initiate and engage in a broader network than the internal network. And that's an Alf Binghamsism about reach to the long tail. That's the InnoCentive founder. So certainly there is a business model. InnoCentive is a very successful company, but it's much more about the network than it is about the event.
So when we think of challenges and we think of who's currently sponsoring challenges, we've got a dynamic mix. We've got venture firms, we've got pharmaceutical companies, we've got the government. Who should be in the mix sponsoring challenges to solve some of their problems and they're not there? It's a softball, come on guys.
We heard from Dr. Berkowitz at lunch about the role that his institution, Northwestern Memorial, is playing in sponsoring challenges designed to encourage people to solve specific healthcare related problems that might benefit them. I would suggest, and respectfully so, that we need more involvement from here in Indiana, particularly central Indiana, our local healthcare institutions, and a far greater level of enthusiasm for embracing some of these new technologies in pilot settings to be able to move that forward. We've had one example, we've had the good fortune of being able to work with a number of those institutions. St. Vincent is one of those, Community another, but there's an awful lot of us in the room and a lot more that aren't in the room trying to make this happen, and we need a much bigger engine behind that innovation. And there is economic incentive now in place, not only for those of us who are developing these solutions, but in fact, for those who consume them.
I think that's exactly right. I think having healthcare delivery involved in these challenges and in an organized effort to be able to identify companies that are out there that have solutions that are benefit to them, and also to have more of a a clear picture and a window into how you get in front of the right decision makers to, if you have a product, if you have a technology like Dave has, to navigate the system to find out who the actual decision makers are, who can help an innovative company, an entrepreneur like Dave, get his product tested, piloted, and placed in those facilities.
And I think from my perspective, not just the who and trying to point to a specific, but it's about what kind of support can you create as you sponsor a challenge once it's done. From my own experience, we've won challenges, but you win money and then the next day it's like bringing a baby home from the hospital. What do I do with this thing? And where do I go next? And with the Codathon, we've got a combination of support, folks that have been there, done it, started numerous companies, have thought through products to offer their time up to those winners post competition, so that you can think through, what do I do next? And that support is there, just as if the hospital were calling you to say, hey, what are you doing with this new baby? And let me help you think through some of this information. So I would offer up that if you are going to sponsor a challenge, find ways to find those support vehicles to support those winners after the challenge is over, so that those products have a much better success of making it to market.
If I can just comment on one of the things that we have done with our new venture competition, it wasn't necessarily planned this way, but as that support kind of generated out from that, with Dave's company won first place, and the second place winner in that competition, a company, Algion, we developed relationships with those companies, with the management of those companies, and as an investor, we've actually gone on to make direct equity investments in those companies and still have maintained I think a few $100,000 we've invested in each of those companies, and have maintained relationships through one of my colleagues sits on Dave's board, and we have the same relationship with the other companies. Now, if that will be a result that is repeated, I don't know. It just kind of happened to come out that way, and I think those relationships and that network of people in that ecosystem is proof of why that happened.
So I love the word ecosystem. I'm definitely like an ecosystem person, and I probably use it in the wrong context all the time, so I'll apologize already. But when we think of an ecosystem, Tom, you think global typically. From a BioCrossroads standpoint, it's more local.
It is.
Right?
It's Indiana based.
So what is the difference? When we think of all the support and the services that you guys have already identified as necessary post awarding the prizes, is there a difference between the global ecosystem perspective and the local ecosystem perspective, and the services and the community and the network?
I'll take first shot. So yes, I want to come back to the previous question, because something's noodling in my head, and that is, in the challenge, do we have representation of the end user or last mile? And often we do challenges and we try to discern the last mile and try to discern what the patient needs and such. And I think we miss the mark of not having more patient advocate community groups in the conversation. So I think from a challenge question, I would help us think through that. In terms of global versus local, there's a lot of difference. I've been fortunate to live in Africa for 10 years, so that's where Kristen gets part of her frame of reference. And there's certainly a lot of difference, and when we run, and if I bring it home to Lily, we run international studies, a phase 3 study, and we'll have 20 countries and maybe 300-400 sites, hospitals around the world. And one of the things we are passionate about is how do we do better trial designs. And one of the aspects of that is when you design a trial from Indianapolis, you don't really know the pragmatics of how that's going to play out in southern France or in Hong Kong or in Buenos Aires. So the engagement of your participants in the process, in this case, let's take clinical study design, has to take in context where the work is going to happen. And so it depends, I guess my fallback to this, it depends on your problem statement. Last year, the challenge that I recall out of this group was managing blood. and tracking blood in Indiana. That's a great problem and a great localized, pseudo-localized problem. And so I don't have a frame of reference that you have to be one or the other, but it depends on the context of your process. And my principle is, are we getting all the way to the end user for the input and the engagement? So in the case, for example, in our team, we believe in agile development because you got to get all the way to the end and get their feedback early and rapidly in the process. And in a distant from the last mile, waterfall, traditional approach, for some reason our products don't hit the market well. And I think, so we have to hold ourselves up to understanding our problem statement and getting to the last mile. And most of the time in healthcare, that's getting all the way to the patient or their direct caregiver.
Anything else to add?
No, I think that our competition is Indiana focused, largely because it ties in with the broader BioCrossroads mission to build the life sciences within Indiana. So having a strong Indiana connection, that's not to say that we don't tap resources who are national or globally based to come into this. So for instance, having someone from 5 AM Ventures sit on our advisory committee that comes in and brings that more of a national and global perspective on what the companies coming out of this need. I think our focus is to support the companies and the innovators who are here locally on the landscape.
Okay, I'm going to ask one more question and then I'm going to open it up to the audience. Got teams that are going to be providing solutions, and then we've got judges who are going to have to assess the solutions to determine who the winner is. Do you have any words of wisdom, either from the completion of your summary of your solution to on the receiving side of doing the assessment? What can help these individuals today so that when they submit in their applications that they get to the semifinal stage, so that then they can go to the next stage?
I would say, from the standpoint of
He's
no,
sponsoring me, that I would pay attention to.
I would say know who's going to buy your product and know who's going to use it, and know what the pain points are from those perspectives. And I think those are very crucial points to understand.
I would certainly echo that. I use maybe slightly different words. You have to know who the customer is. That's the first and foremost question in any new venture. It isn't what you're going to build for that customer. It's knowing who it is. And then you need to understand clearly and be able to articulate clearly the compelling business problem that you're going to go out about solving for that customer and how only you can solve it. And then third is the method by which you go and provide the solution. And typically innovators will think about those three questions in exactly the reverse order. And that's not effective for folks like Matt, who are sponsoring contests or providing funding through their venture fund. They need it in the order that I described it, and I think you'd agree with that.
Any other thoughts?
I have one. I come back to my initial comment is it's more than the event, and it's more than submission. Make the most out of the networking, the connections, the diversity. Enjoy yourself along the way. Don't forget these fundamentals of customer and the problem solving, but enjoy yourself along the way.
I think that finishes it up.
Good?
Come to the
You don't have to go all the way.
Let me finish it. Come to the Codathon.
There we go.
Yeah, exactly. I guess from my perspective, it's twofold. It's the same thing at the front end as the back end, right? What problem am I trying to solve? How am I solving it? And what value am I bringing for my team? And both times we've expressed that in our submissions, and both times we've had a pretty good result. So that's how I would go about it. And have a lot of fun doing it, because these are people that ultimately, if you're going to go into business with, you're going to get married to, and you need to have fun together.
Any questions from the audience?
So I'm not a participant in the challenge, but just had a question out of curiosity. So I'm going to steal Brian's idea of bringing the baby home. So the question is, what happens to the baby after the baby's home? Does it change depending upon whether you are Eli Lilly or BioCrosswords or Brian Norris or Infuse. And the baby, what happens to the baby? The other part of the question is, depending upon who you are, the big vendor or the smaller outfit, does your baby benefit the community or the Wall Street? Are there any differences?
Lots of questions.
I'll try to take a stab at that from my perspective. Dave and I might actually have different, sort of similar views, but different. So our baby came home and it grew up, and then we matured, and then we had to think long and hard about, great, we did something cool, we won something. We ultimately turned the challenge sponsor into a client. But we had to think about where we wanted to go as an organization and who we wanted to be and what values we had and where we wanted to position.
So I tend to think of things through a portfolio of innovation frame of reference. And what I typically see coming out of challenges or ideas are pretty early, arguably unproven. And so assuming there's merit and then you get some, there's a construct for support, a la generation at each phase, which has its own nuances. So I think of it in that manner.
I guess I would just add to that. I think when the baby comes home, I think there always are evolutions to whether it's the technology or the team or the approach to the market. But from my perspective, when we do build that relationship with the team, so with Dave as his company won the new venture competition last year, building that dialogue and getting to know that team more, we came to the conclusion that there was an alignment in where we saw kind of the path forward, and it was in alignment with where the company was going. So I think it's not a drastic change. I think there are changes along the way, but I think it's a process of going in a common direction.
Let me comment on this, the last part of your question, which was about Wall Street or the customer, if I understood it correctly.
Yeah, social versus
Is it social versus Wall Street? I don't believe they have to be, they have to be mutually exclusive. In fact, they're best when they're not. That the motivation to do good work and to be rewarded for it is universal, and it's a good thing, and it has spawned tremendous, that desire to build a great business and to make some money along the way and to do good has spawned all of the innovations that I know about to this point. Nothing wrong with both motivations, and they should work well together. And one aside, so long as they're guys like us, we're going to need physicians like you around.
We'll take one more question. I think Kirby was going to cut me off.